Application of hot water bag. Fill the bag about 1/2 to 2/3 full of water at 55 to 60 degrees Celsius.
So, Mom, good morning. I am Saidi Jari Bigumali and I will be your nurse for today. Okay, so Mom, can I have your armband, please? Okay, can you please state your name for me, ma'am?
I am Yasin Janleia de Dolo.
How about your age?
I am 20 years old.
Okay, Mom, thank you. So, Mom, for today, I'm gonna be conducting an application of hot water bag. So, would that be okay with you, ma'am?
Yes.
So, to begin with the procedure, I must first check if there are any leakage on this hot water compress. So, in order for me to do that, I'm just gonna unscrew this one and place a small amount of water inside. So now I'm just gonna close it. And turn it upside down. So as you can see, there are no any leakage of any water here in this hot compress. So now I'm gonna put back the water in this glass. Now, I'm gonna fill it with about 1/3 or 1/2 of warm water with a temperature of about 55 to 60 degrees Celsius. So I'm just gonna fill it in.
Place the bag on a flat surface and remove all air from the bag.
Okay, so now I'm just gonna place this hot compress on a flat surface and remove any air excess from the bag. Okay,
Close the mouth of the bag.
now I'm gonna close the mouth of the bag by closing the screw.
Invert the bag. Dry the outer side of the bag.
Okay. So before that, I'm just gonna go and get a towel for this procedure.
Cover the bag with cloth or a cover.
So now I'm just gonna invert the bag and dry it. Okay. And cover the bag with a towel.
Place it gradually over the area to be warmed, covered by a towel.
And after I've covered this one, I'm gonna place it on the area gradually to be covered with a towel. This towel will serve as the insulator. So now I'm just gonna place it on the client's arm. So I'm gonna have your arm, please. Okay.
Change the water inside when it cools.
So always remember to change the water inside when it cools.
Empty the bag after use. Dry it well from inside and outside.
Okay.
Let some air in and keep it in a cool, dry place.
So now I'm gonna remove the hot water compress, okay? So after removing it, I will now remove the towel and unscrew the cap and empty the hot compress. So now I'm gonna have to dry the inside and the outside of the hot compress using this towel. And let some air inside. And screw the cap. So now I'm gonna have to place it in a nice, cool, and a dry place.
Document the procedure.
So I'm just gonna remove all these equipment here. So after that, I'm gonna have to document the procedure with my signature in it for any legal purposes and report any significant findings to the senior staff. So with further ado, let's begin to the return demonstration video. Thank you. Good morning, I am Seri Charity Dumaliw, and for today, I'm gonna be demonstrating the application of hot water bag. So with further ado, let's begin with the procedure. Thank you. Good morning, ma'am. I am Seri Charity Dumaliw, and I will be your student nurse for today. Can you please state your name for me, ma'am?
Good morning, I am Miss Lea de Jola.
How about your age, ma'am?
I am 20 years old.
So, ma'am, for today, I'm gonna be conducting an application of hot water compress or hot water bag on you. Would that be okay with you, ma'am?
Yes.
Okay, ma'am. So, the first thing that I'm gonna do is to check for any leakage of this hot water compress. So, I'm just gonna unscrew this one. And put a small amount of water in here. And close the cap. And then turn it upside down. So as you can see, there are no any presence of leakage here. So I will now remove the water inside. So I'm just gonna unscrew the cup and return the water in this glass. Okay. So now I'm gonna have to put a water of about 1/2 to 1/3 with a temperature of 55 to 60 degrees Celsius. So I'm just gonna put the water in here. Okay. So now I'm just gonna place it in this flat surface to remove any air from the inside. Okay. And unscrew or screw or close the cap. Okay. And invert it. And dry the outside of the cap. So after drying it, I will now cover it using this towel that will serve as the insulator. Okay. So now I'm gonna have to put this in a specific area on the client. Okay. So as you can see, the towel is already placed here. So I'm just gonna put this on the client's arms. So mom, I'm just gonna put this here, okay? So always remember to check the hot compress periodically. So and always keep in mind to change the water when it cools. So now let's assume that the hot compress is already done. So now mom, I'm gonna have to remove this one, okay?
Okay.
So after that, I'm gonna have to empty this hot compress. Okay. So I'm just gonna unscrew it here and discard the water in this glass. So after discarding it, I will have to dry the outside and inside of this hot compress. So I'm just gonna wipe it using this towel. Okay. And put some air inside it so that the inside can be as dry as the outside. So now I'm just gonna close the cap. And after that, I'm gonna have to place it in a nice, cold, and dry place. So now I'm just gonna remove all the equipments that I have used for this procedure, okay? So after that, I must now document the data for legal purposes with my signature in it. And of course, report any significant findings to the senior staff. So that would be all for the application of hot compress, and thank you.